Welcome back. Extreme weather in the Midwest, funnel clouds in Oklahoma and Kansas. Dr. Ernest Patti is with us now of St. Barnabas Hospital in the Bronx, New York. And what kind of injuries do people receive during tornadoes?
Well, you get usually three different types of injuries. The most common are these complex and contaminated soft tissue injuries, which you get from the flying debris and particles that are surrounding the large winds in the tornadoes. There's a certain injury that's unique to tornado injuries where you get a dermabrasion to your skin. It's almost like sandblasting your skin. The second type accounts for about 30% of injuries are fractures. And a lot of these require hospitalization because the majority of them are open fractures. And the third most common injury that they see is head injuries. Fortunately, these tend to be less in volume, but the most common cause of death when you sustain a significant head injury.
I walked into a hospital in Kansas after the Andover tornado. I was a reporter there at the time. There were people with wood, sticks from trees, lumber from houses that had literally impaled them.
Right. Those are the complex soft tissue injuries we're talking about, where you get foreign bodies impaled into you. And those present infectious problems as well as surgical closure type problems.
And Dr. Patti, you say that the injuries as they are reported will come in two waves.
Usually they come in two waves. Usually the first 15 to 20 to 30 minutes after a tornado has dissipated, you'll get the walking wounded, those people who make their way to first aid or to a hospital. Then in the next 1 to 4 hours, vehicles will start showing up, private cars, EMS, ambulances, however they can get there.
Just days ago, we saw a town devastated in Texas, and of course, Joplin almost 2 years ago. I would imagine post-traumatic stress disorder occurs.
That definitely occurs. And you have to remember, many of these people, the loss of life, property, and also their livelihood. Many of them lose the ability to provide for their families after that. That creates a significant mental anguish.
And then already, widespread power outages being reported, which will also affect, the ability to respond to some of these injuries and treat them.
Sure, and treat them as well. Fortunately, all hospitals are required to have backup generators, but many times they can't provide, the full amount of power that you need to use all of your facilities.
We saw that in our area with Sandy.
Yes, we did.
Certainly did. All right. So, and the other thing that we've been following, hail the size of grapefruit, so head injury from that.
Head injuries, definitely. Head injuries. The most important thing is to seek shelter, try to get out of the way or the path of the tornado if possible, and to use common sense.
Dr. Ernest Patti,
Stay
St. Barnabas.
inside.
Thanks very much.